Hello everyone. In this short video tutorial, we will be talking and discussing about why there is an additional need of a scanner or impression at the end of the aligner treatment. Okay, just like the fixed appliances, we do have the final stage of fixed appliances, that is the settling phase. What we do in the settling phase, the posterior teeth are not properly seating with each other, and we advise some box elastics for the proper interdigitations of the teeth. Exactly like in the clear aligner treatment, when we have treatment of 6, 7, 8 months, because of the thickness of the aligner, we have some disturbed posterior occlusion. So in order to correct that disturbed posterior occlusion, I advise two things: either you to shift the patient on the nocturnal wear of the aligners, or trim the aligner distal to the canine so the posterior teeth can settle down again. And once we have corrected the disturbed posterior open bite or posterior occlusion and the teeth get interdigitated with each other, we do advise another scan or impression at the end of the settling phase of the aligner to have another set or pair of the retainers. And as per a rule of thumb, there must be a pair of retainer, an additional retainer as a backup to if the patient lost the aligner, so another pair must be available. Thank you.